Hi, my name is Aiden. I am 9 years old and I have ATS.
My name is Christian. I'm 17. I have ATS.
My name is Maggie. I'm 6 and I have ATS.
I'm Jordan and I'm 8 years old and I have arterial tortuosity syndrome.
ATS is a genetic abnormality that produces abnormal growth in certain vessels. And the vessels, because of their abnormal growth, become long and curved and bendy, and so hence the term tortuosity. So it's a genetic abnormality having to do with abnormal vessel growth.
ATS means we have to go to the doctor and we go to the hospital a lot.
ATS causes your arteries to grow too long and can causing you to have lots of surgery.
5 hernia repairs and 3 surgeries.
I have to take a lot of medicine.
The symptoms from a child with ATS can be varied. It's sometimes very difficult to make the diagnosis because the presentation in the children, the way they present and the organs that are involved seem to be different from one child to the other. So depending on where the vessels are that are involved in the syndrome will be the presentation. Some children present with abnormal vessels in their lungs, some present with abnormal vessels in the head and neck arteries, in the brain, and the other body organs. So there's lots of, there's a varied presentation because of the abnormalities associated with the disease. And we're still discovering and describing and learning these presentations so we can be more adept at making the diagnosis when these children present.
My name's Andrea Taylor, and I am from Owasso, Oklahoma, but do most of my work in Arkansas, and I have 2 children, Aaron and Aiden. Our story with arterial tortuosity syndrome really started with the birth of Aiden in 2008. The pregnancy was normal. We didn't have any kind of complications, no gestational diabetes or elevated blood pressures or anything like that, and he was to be delivered as a cesarean. And so his birth was planned because of a previous C-section. And when he was born, everything seemed fine. You know, we noticed a few little things here and there about Aiden, that he had a very long torso and that he had a little bit of an aged appearance. We joked that he reminded us of my grandfather a lot. Other than just a few issues with pneumonia and, you know, he had a little trouble swallowing when he was younger. We really didn't notice that much to make us ever think that there was anything really wrong with Aiden.
I met Aiden in 2010. At the time, we didn't know his diagnosis. He went to the cardiac catheterization laboratory because of concerns for pulmonary hypertension. And during the procedure, we found a very unusual tortuosity of his vessels involving his lungs and his great arteries to his head and neck. And following that catheterization, I inquired from one of my genetic colleagues about what could possibly be the cause of this picture on the angiogram, and that's how we stumbled onto the diagnosis of ATS.
So in 2010, Aiden was about to turn 2 and he had his first bout of pneumonia that landed him in the hospital at Arkansas Children's. And he stayed in the hospital about a week. They released us, everything was fine. We went on our way, and then about 6 weeks later, he caught another virus or had RSV or something, and they ended up putting him back in the hospital. And that's when they heard the heart murmur for the first time again since his birth. And there was no indication that we really thought there was anything wrong with Aiden, but they started asking then if we thought that he might have cystic fibrosis or some kind of issues, because the lungs, the pneumonia settled in the same part of the lung each time. They did a CT of his chest, they found the tortuosity, and then learned that he had pulmonary hypertension and that his heart was a little bit enlarged, and so he had an exploratory heart catheterization because they saw a hairpin kink in his left pulmonary artery. And that is when they started talking to us about it being arterial tortuosity syndrome. He couldn't tell us what a diagnosis plan was. He couldn't tell us mortality rates. All he could tell us was that Aiden was stable at that point in time.
My name is Ginger Knapp, Ginger, Knapp, Knapp. I'm from Wisconsin. I live there with my family, my husband and 3 children. Our youngest daughter was diagnosed with ATS almost 3 years ago now. I pretty much wake up in the morning thinking about ATS, and I go to bed at night thinking about ATS. ATS somewhat rules our life.
My name is Amanda. I'm Christian's mom. I'm from Ripley, Mississippi. My ATS story started when Christian was born. He had pneumonia and inguinal hernias and enlarged artery. So he was in the hospital for a couple weeks, and then we came home. He was incorrectly diagnosed with Soto syndrome when he was 6 months old. They didn't have a test for it back then, so up until he was 8 in the end of 2008, when he started really getting sick, that's what we thought he had.